But first, joining us now is the National Party leader of the opposition, Judith Collins. Morena.
Oh, good morning, Ryan.
Great to have you on the show, as always. Hey, was someone trying to roll you at the weekend?
No, certainly not. I think that it was pretty amazing that the Labour Party seemed to be coming through from some of their activists. And, look, they were dealing with a situation where we had 7 people injured from the Linmore terrorist situation. And there they were trying to play silly games. Just get on, do the job, I say, and do the role of government.
So that's a categorical no. No one was running the numbers at the weekend, to your knowledge, the National Party.
Absolutely correct. No one was.
Okay, all right.
People were focused on their jobs.
Well, that's Twitter for you, isn't it? I suppose, unfortunately. Let's talk about something important, shall we? Let's talk about level 2. Mm-hmm. How is it, when we seem to have some quite significant changes for business to level 2 settings, that the businesses were only advised days before they had to implement these new rules, and they've been left scrambling? You know, they've had all these weeks in lockdown that they could have been planning. They were left scrambling. Why?
Well, that's a very good question for the Prime Minister. I mean, quite clearly we knew that Delta was at our border in April. It was being picked up then in the MIQ facilities. It was always going to be a matter of time before it got through. And it looks as though for the last few weeks people have been sitting around saying, well, let's just lock down, and no plan for how to open up. And particularly when you look at the South Island, I mean, I just heard the chap on you had before from the Borough in Christchurch. He's a really positive person, trying to make the very best of the situation. And that's what people want to do. They want to do their best, but they do want to know what the rules are so that they don't end up like the poor old truckies who are suddenly being told now they have to go and get COVID tests to be able to go and do their essential job. And they're also told if they don't have symptoms, they can't go to the big vaccination pop-up centres. So, looks like one part of government doesn't know what the other part is planning.
Yeah, it's very strange. It's very strange because it does seem like it's just sort of being made up as we go along, as opposed to there being a Delta plan for an outbreak like this. Let's talk about David Seymour. How would you describe him, David Seymour, and the fact that he tweeted out this vaccination code? Is he A hero standing up for equal access for all New Zealanders, B, irresponsible and wrong, or C, a Cockwomble?
That's awful choices. Look, David has to answer for himself. He's an adult. He's the leader of his own party. I'm thankfully neither his mother nor the leader of his party. And I just think he's the best thing I say to people is get as many people vaccinated as we can. And if you're dealing with people who can be a bit hard to reach sometimes with vaccination messages, you do whatever it takes.
Okay,
because
so that means
COVID
positive discrimination. So that means that you, as the National Party, would agree with positive discrimination in the way that it's being carried out.
Well, it's not positive discrimination, really, is it? Saying the Waiparere Trust, which is a whānau ora provider, wanting to encourage Maori to get vaccinated. Look, Maori being not vaccinated is a problem for everybody in the community. So my view is you just do what it takes. And the National Party is not particularly ideologically based. We're a very pragmatic party. And that's our number one principle. Sort out what needs being done and then just do it.
Okay, so you would agree with this, which is excellent to hear. Māori have a 19% of eligible Māori have been vaccinated. You compare that to about 30% for European and other ethnicities. This is a failure, no matter which way you look at it. What else would National do to get that Māori vaccination rate up?
Well, there's some ideas here. So for a start, I thought that the Maroi had actually been doing a really good job. Manurewa Maroi, they had been involved. We would have had the Papakura Maroi involved. Why? Not just because they're Maroi, but they also have, particularly in Papakura, their own medical centres based there, and people go there for their medical treatment. We would have had people in the community going out to people, not just saying, come and see us. So that could be around the GPs. It can also be our nurse practitioners, but our pharmacists, because they're really accessible to people in the community. You don't have to go a long way to do it.
Pharmacists not necessarily effective for Māori, who some of whom have a distrust of healthcare providers like pharmacists, right? So you're saying perhaps get a mobile system going where you go out to whānau and communities.
Well, it's not impossible to do. And when we find out, as we found out earlier this year, is that the vaccine can be kept in a refrigerator in a doctor's surgery for a week, you think there should be able to be some system where you could just mobile get out to people. And particularly if you're talking about rural New Zealand, if you're talking about places like Northland, the East Cape, those areas, they're really quite isolated, and medical practitioners are few and far between. But the other thing is you have to have people that people trust, and that's one of the issues I think around some of the vaccine hesitancy, is having people that you trust and know. That's
Absolutely.
really important.
It is, indeed. Judith, thank you very much for joining us this morning. I didn't get you to say Cockwomble, but we came very close, didn't we? Judith Collins, Leader of the Opposition with us this morning. It is 28 minutes.